Good afternoon, everyone. Allison Scoberg here, Consolidated Planning Group. We are happy to be partnering again with North End ISD today. Thank you for being here. If this is your first time attending a webinar with CPG, welcome. We're glad you're here. If you've attended our webinars in the past, we are certainly glad that you are back. I always like to go over a few housekeeping items before we get started today so everybody kind of knows the lay of the land. We are in webinar mode today, which means that we can't see you or hear you, but we do know you're there, and we are glad that you're here today. Today's webinar is being recorded. Everybody is going to get a copy of today's slides and a link to the recording in their email later today or tomorrow following this webinar. All of our past webinars live on the Consolidated Planning Group YouTube channel. So the Consolidated Planning Group YouTube channel, there are over 500 webinars on planning for special needs. If you can think of a topic, we've probably covered it, and it lives out there on that YouTube channel. And again, you can subscribe to that for free. We're always happy to give you a copy, a PDF copy of the slides. So if you go out to the YouTube channel and you listen to one and you'd like a link to the slides, all you have to do is email us and let us know. Likewise, if you're listening to us on podcast as well and you would like a copy of our slides, you can email us at contact@cpgcares.net. That's contact@cpgcares.net, and we'll send you a copy of those slides as well. We had a number of wonderful write-in questions today, and I'm going to attempt to cover as many questions as we can during the time that we have together today, but I do want to get through the content. And as you guys know, and probably one of the reasons that you guys are here, when we start talking about government benefits, namely SSI and SSDI, things start getting dicey and things start becoming confusing. So we are aiming to chat about those things today and kind of unwind some of the confusion and empower you, give you some tools and resources that you need to move forward with government benefits. So Consolidated Planning Group, we are a holistic special needs financial planning firm. We're nationally certified as Social Security advisors, members of the Special Needs Planning Academy, certified special needs consultants, nationally certified as Social Security advisors. Our whole firm is nuanced and planning for families who have a loved one with a disability, any age, and we work all across the United States. We are domiciled in Texas, but we do serve families all across the United States. We help put lifetime protection plans in place, lifetime care plans. We do a lot of transition planning. We help set up ABLE accounts, which we're going to hit on today as we're talking, and we do a lot of advocacy by way of our webinars. When it comes to planning for special needs, I always like people to understand the difference of what we do as special needs planners and what an estate planning attorney or a special needs attorney does, because it's two different things, and oftentimes people are confused. They think that the attorney can handle the financial things and that we can handle the legal documents. And the truth is when you're, planning for special needs, you need more than one person on the team. So you'll have to have the legal team, and they're going to be in charge of setting up documents like special needs trust, guardianship, those types of things, wills. And then a special needs planner, they're going to help you understand how much money do we need to fund a special needs trust, how do we maintain eligibility for state and federally funded programs, how do we make sure that we have money in the right buckets. So it's important that you work with a specialist. I always just say, whether you work with us or somebody else, if you're planning for a loved one with a disability, you do want to work with a professional that is specifically nuanced with people with disabilities, because when they're not, you can accidentally lose eligibility for state and federally funded programs that you work so hard to get, and oftentimes waited a long time to get them. So the first thing that we're going to talk about today, anybody who sent in a question, I already have those questions. If you haven't sent those questions in, if you have questions in the chat box, you can put those in the chat box today. But if you already sent them in, no need to put that in the chat box. So the first thing I want you guys to understand is SSDI versus SSI. They are two very, very different programs. but oftentimes people in general throw around these terms as though they are the same program. They're vastly, vastly different. So the first thing I want you to understand is one of the confusing things I find is it would only make sense if I have a loved one that has a disability that they might qualify for SSDI, Social Security Disability Insurance. That just makes sense. But the truth of that program is that it's under Title II, and the source of the payment is through the Disability Trust Fund. So as we work, we build quarters through the Social Security Administration, and we become insured for Social Security and for SSDI. It pays benefits to disabled individuals who are unable to work regardless of their income and resources. Benefits for workers and for adults disabled through since childhood must meet the insured status requirements. So typically when we apply for benefits, you're applying for both SSDI and SSI, which we're going to go over in a second. And oftentimes, if you have a child or an adult child with a disability, when you apply, you may promptly get a denial letter from SSDI saying that they haven't paid enough into the system and they're not insured. That is a typical letter. It is expected. It should be expected, although they don't tell you about it. But what that letter doesn't say is that they're still processing the application for SSI, which is under Title 16. It's a completely different program. So SSI, Supplemental Security Income, payments come from the general tax revenues, not the SSA trust funds. It's a needs-based public assistance program, and it does not require a person to have a work history, and it pays disabled individuals unable to work and that have limited income and resources. Okay, so this is for the disabled and for the indigent. Benefits for children and adults in financial need must have limited income and limited resources, and the asset limit for SSI is $2,000. This is also commonly referred to as the Medicaid asset resource, which is true for Texas. It is true for many states and most states, but there are some states that have higher asset limits for Medicaid. So if you're listening in from another state, you're going to want to check your Medicaid resource limits for your state. But regardless, the resource limit for SSI is $2,000. So the first things first, if you're taking notes, is understanding the two different programs and how they work and how they're not one and the same. So the confusing thing is we have SSI and we have SSDI. There are programs through the Social Security Administration that sound the same, that are not the same at all, and other programs that have 3 or 4 different names that are the exact same program. So if you've ever felt confused by all of this, you are definitely not alone. So when it comes to disability rules over age 18, SSDI and SSI, a physical or mental impairment, the disability is expected to last 12 months or more or result in death. They're going to look at age, education, past work activity, and whether or not the person has the inability to perform substantial work activity. Okay, so we're going to talk about SGA in just a moment. A person says in the chat box, if you apply for SSI and you have an LLC that is not generating income, is the LLC considered an asset? I created my own LLC last November, but not getting off the ground yet. So that question is going to depend on whether the kid, your disabled individual, is a child and if they are under age 18, or whether they are an adult and over age 18. So the curious thing, some people have applied for benefits when their children were under age 18. When we're applying for SSI and our kids are under age 18, it is based off of the income and assets of the parents, not the child's. Under age 18, it's based off of income and assets. And as a reminder, I had mentioned that SSI is for the indigent and the disabled. So it may not be that the child isn't disabled. They may not be disputing that the child is disabled, but what they're saying is you simply don't qualify for this because you make too much money or you have more than $2,000 in your name. Okay, so that is the one thing that you've got to know. The other thing that you got to know is that everything changes when they turn 18. Once they turn 18, it's based off of their income and assets, not yours. And this is also including even if they live in your house, even if they're under full guardianship, even if you claim them on your tax return, once they're over age 18, it's based off of their income and assets. So I always like to mention that to people because what that means is that they've been denied in the past, then you're going to need to reapply once they turn 18. And I suggest applying the month following their birthday. We'll talk more about that. So the other thing that I want to mention for anybody that's on here that their child, a minor under age 18, is still getting SSI right now, everything changes when they turn 18. So you need to reapply. You will need to notify the Social Security Administration if your child who's turning 18 is going to remain in school. There is a form that can be downloaded from the Social Security website that the school will sign off on that the child is still a full-time student, and then they will continue the SSI benefits through age 19. And this is an important form to get in because otherwise the benefits can abruptly stop at age 18 and applications are taking over a year right now in Texas. Now, there are many other states that are not taking a year. And so, it could be faster in other states, but applications are taking a year in Texas. So I will look up that form for that, but it basically is notifying that the child is still in school. I'll give you that form before the end of this meeting. So I want to just talk about SGA for a second, and then we're going to look at a couple of our questions. Substantial gainful activity. The thing is the Social Security Administration has acronyms for everything. So they call this SGA. And basically what this amount is it's a gross monthly earnings. So the amount for SGA for 2025 is 1,620 gross earnings per month. And if the individual is blind, it's $2,700 gross earnings per month. And basically what the Social Security Administration does with this is they basically say if a person is working and they're earning more than 1,620 gross earnings per month, then simply they're not disabled. And they will automatically be denied for SSI. SSI is going to use SGA as a measure of work during initial claims, and SSDI is going to use this for the life of the claim. So as far as there's not a special form for a person who is legally blind, it's just saying that the substantial gainful activity is higher. They have a higher threshold for substantial gainful amount of earnings, gross earnings per month for that. So I want to go through a couple of questions that we have. Is there a caregiver benefit to parents who also serve as full-time caregivers if my child were to qualify for SSDI or SSI? And there is a caregiver benefit. It's called the mother-father benefit. And if the individual, the parent, is not working and the child qualifies for benefits, there is a mother-father benefit that could be implemented prior to turning on their own benefits. Can one get SSI and SSDI? What about Social Security based on father retiring and taking his Social Security? So the answer is yes, yes, and yes. There is a possibility of a person getting some SSI and some SSDI, and they're not going to give full amounts on both. So they may qualify for some SSI, some SSDI under their own record, and they may still be getting the full the full amount, which is $967 a month. And if the person with a disability had a disability that started prior to age 22, they do have the ability to be covered under a parent's record. We're going to talk more about that in just a minute. One person says, do adults with autism qualify for these benefits? And the answer is it depends. Autism is not necessarily a slam dunk. It depends on the level of autism that they have and how autism affects them. There are something called presumptive conditions, and autism is not one of them, so we will talk further about that. Do you recommend going ahead and applying? She will not qualify due to our income, or should we wait until she turns 18? You absolutely should wait till after your child turns 18 if you are above the income and assets limit, because they're automatically going to be denied and it's going to be a waste of time. So I would wait the following month after their 18th birthday. Okay, how does being outside of the US for a month or more affect specific benefits? Now that's a loaded question. So if you are outside of the country for 30 days or more for SSI, you have to notify them and they will stop the benefits until the individual is back in the country. If you are getting Social Security or Social Security disability or childhood disability benefits that are all under Title II, then the individual would continue to get those benefits even if they were outside of the country for more than 30 days. One person says, I keep getting denied for SSI for my son because they say he doesn't qualify because he's never worked. When they say he doesn't qualify because he's never worked, they are referring to SSDI, not SSI. So if you applied for both, it sounds to me like the SSI application may still be cooking. Like I said, these applications are taking a year or more to process. So he was probably denied for SSDI because he's never worked, which is correct. And they're still working on the SSI application. Okay, so let's talk about the SSI benefit rates. So for 2025, these rates go up a little bit every year. Also, the substantial gainful activity amount goes up a little bit every year as well. So right now for 2025, the SSI benefit rates are $967 a month. If there is a couple and they're both disabled, that is $1450 a month. Okay. So one of the things I like to mention on that one is if your child is getting SSI and they're getting about $644 a month and they are not working, they're not getting the full amount. And the reason they are not getting the full amount, that tells me that you have not submitted a rent or a fair share agreement indicating that your loved one with a disability is paying rent. If you will send in a simple rent agreement. It could be any amount, $300, $400, $500 a month. $500 a month is what we see most often, letting them know that your loved one is paying rent. They will increase that amount of SSI from $644 to $967. SSI is reduced by 1/3 if they're not paying rent. So you can fix this. We suggest submitting the rent agreement by fax is what we suggest. A lot of the Social Security offices are understaffed right now. They're overworked. They have a tremendous number of calls and applications and things going on every single day. So when you fax something into the Social Security Administration, it goes into their electronic queue and it gets routed to your child's case. So even though faxes are kind of archaic, I do suggest that. So we do have a question in the chat box. Can we raise rent by redoing a rental agreement? You absolutely can. And you would just submit that in to the Social Security Administration. And what I would say is sometimes you do need to follow up on that form. It doesn't always get processed quickly. So you might need to follow up and make sure that they are processing that form. I just wanted to take a minute before we get too far away, and I wanted to look up, it's the SSA, the form is, if somebody wants to put this in the chat box for me, that would be helpful. The form to advise that your student is still a full-time student and will be in school is an SSA 1372. SSA 1372 BK. SSA 1372 BK. You can download that from the Social Security Administration, get it filled out by the school and signed off on. And this is also true. My advice on that is get it done before the school year's over and out for the summer. It's like a ghost town at a lot of the schools during the summer. A lot of people are off during that time. It may be more difficult to get that signed off on by the school over the summer. So if your kid is turning 18, towards the end of the school year or close or over the summer, try to get that form. If they're going to be a full-time student, in the fall, try to get that form signed ahead of time. Okay, so a couple of questions. It was the SSA 1372 BK. One person says, I was told that things move faster if my child has a state ID. I have an appointment with the DMV for the end of October. Should I wait till he has it to apply for SSI? I don't know that anything necessarily moves faster if they have a state ID. I mean, you have a birth certificate, you have a social security card, that's good enough. I wouldn't postpone in that example, but I do think it is helpful for people to have a state ID. Most of the DPS offices, they do have a disability appointments. You could get a special appointment for an individual with a disability. So you might want to check on that on their website or call them and ask. One person said, do we need to inform or put a form in the Dropbox? Do we need their approval before? I'm not sure what that is for. So clarify your question, please. What is the best way to apply for SSI, online or in person? We're going to get to that in a second. Generally online. Some people prefer in person, but I'm going to talk to you about the differences of both. At what point during the SSI process do you recommend faxing the rental agreement? You can make sure that whenever the application is submitted that you let them know that. But they usually are not going to process that until that person is approved. And again, that approval could be a year from now. So you'll probably need to submit it again later. So like once they've approved, you'll get a notification that they've been approved. When we raise the rent, do we need to wait until SSI approves it? Raising the rent is not going to raise the SSI. So if you already have the rent in place, then you should be getting the full $967 a month. Even if you raise the rent, they're not increasing the SSI. So I don't necessarily see any value in raising the rent unless you just need to. So you can kind of stick with whatever amount that you've got, or you can raise it if you want to. So let's talk about the Social Security Blue Book. The Social Security Blue Book is basically a medical impairment guide. It is online on the Social Security website. And this is the medical impairment guide that they use to determine if a person is disabled or not. And they have conditions listed by neurological disorders, cardiac disorders, you name it, just the different bodily systems, skeletal disorders. They have it listed by systems. And there you can look up all of your loved one's diagnoses and see what kind of proof they're looking for to prove that the individual is disabled. And one thing that I want to caution you here, they have child listings and they have adult listings. And although a lot of you may be here and you're looking at this for your child, if your child is over age 18, you do need to be looking at the adult listings, not the child listings. Okay, child listings are only applicable if the individual with a disability is under age 18. And the other thing that I would say here is don't forget all of the diagnoses. So there might be glaring ones. A person may have an intellectual disability and Down syndrome. Maybe they have Down syndrome and autism, but maybe that person also has insomnia, anxiety, depression, other things that go along with these diagnoses, also known as comorbid conditions. Look up all of the diagnoses, not just the big ones, because sometimes you may be surprised what qualifies them for a disability versus not. Okay, so what should you apply for and when? And this is going to kind of go to the question on should we apply online or not. I suggest applying for SSI the first of the month after the child's 18th birthday. If you're going to go in person, I suggest calling and scheduling an appointment in a few months in advance for after they turn 18. You can apply through your local office by phone or online, and this is the link that you can apply online. This will save the date of the application, and if approved for benefits, it'll be backdated to that date. Applications online are not fast. I mean, you could fully expect for it to take a couple of hours, an hour to 2 hours, to do that. You're going to want to have the, basically when you're getting everything together, you're going to want to have the medical history. What were they diagnosed with in what year? What medications do they take and what are they for? They don't care about the milligrams, but they want to know what they take and what they're for. You're going to want to have the names, address, and phone numbers of the doctors that your child sees. Do they see a neurologist, a cardiologist, an oncologist? Do they have a primary care physician? Do they see a psychiatrist or a psychologist? I will caution you that they're not going to take the records from a licensed clinical social worker. They will take it from an MD, a DO. So psychologists and psychiatrists are cool. MD is cool. Social worker, not cool. So you're going to want to have the names, address, and phone numbers of all of those physicians. You're going to, if your child works, you're going to want to have the name, address, and phone number of the employer. How much do they earn? What is their hourly wage? And their pay stubs and the last 3 months of bank statements if the individual has a bank account. I suggest chatting with the PCP first and reviewing their records before you submit the application, because you know you've already looked at the Blue Book. You know what the Social Security Administration is going to be requesting as far as proof of your child's disability. So you can ask them, say, I'm about to apply for SSI. Here's what the Social Security Blue Book says that we have to prove for them to be disabled, and they're going to be getting your medical records. And I just want to know if your medical records show these diagnoses. So this is kind of the polar opposite as adults of what we do. We go to the doctor, and if the doctor says something's wrong, you say, don't write that down. Well, for our loved one with a disability, the records need to be clear what the disabling conditions are, how it affects their activities of daily living, and what all of the diagnoses are. So you might want to check on that. That's not something that you have to do, but it may expedite the process. You want to have evidence that demonstrates that the child's disability began prior to age 22 to qualify for childhood disability benefits, also known as CDB. And it was formerly called Disabled Adult Child, and the acronym for that was DAC. It was called DAC for 40 years, and 3 or 4 years ago they changed the name to CDB. But sometimes when you call the Social Security Administration, you might be talking to someone who's worked there for 30 or 40 years. They may still use the name as of DAC, but DAC and CDB are the same. Disabled Adult Child under a parent's record. Okay, and basically what this is, and so remember, CDB and DAC, SSDI, they are all under Title II. So remember Title II, I said you had to pay in to that system. Well, there is a caveat for that. So if we have a kid who has a disability, whose disability started prior to age 22, they have the ability to be covered under a parent's record. I'm jumping ahead a couple of slides here. Wow, a lot of slides. Okay, so they have the ability to be covered under a parent's record. So basically, when a parent applies to receive their own Social Security benefits or SSDI, the child is entitled to receive half of the parent's record. So if dad's benefit is $4,000 a month, then the child will start getting $2,000 a month. And after 24 months, that child will be eligible for Medicare. Now, in the most ideal situations, the kid qualifies for SSI and Medicaid first. That's the ideal order, because when they do that, they have Medicaid protections that will protect their higher income when they move over to the childhood disability benefits, also known as SSDI, under a parent's record. It will protect them, which will allow them to keep Medicaid and then be eligible for Medicare in 24 months. Some people can't help this. Some parents are already disabled. Some parents have already passed away, and the kids are getting RSDI, Retirement Survivor Disability Income, which is also under Title II. So you can't help that if that was the way. Now, you're never going to qualify for SSI Medicaid, but you may qualify for Medicaid in the future under a Medicaid waiver. So how the CDB benefit would work, if they were getting SSI first and they were getting $967 a month, dad turns on his Social Security benefit, he's getting $4,000 a month. The child's going to get $2,000 a month as long as the child remains disabled, as long as the dad remains alive. If dad passes away, the child's benefit is going to be increased to 75%, which would basically be $3,000 a month and would pay for the rest of the child's life as long as the child remains disabled. You do want to be aware that this calculation is not always 100% because there are such things as family maximums that that can affect the benefit, and it might not be exactly the same amount. So we have a couple of questions, and I'm going to address those really quickly. Let's see. Is there a rental agreement for this suggested format? Yes, we do have a rental agreement. You can reach out to us by email for that. Is there a way to check the status of an application? We were turned down for SSDI, and I want to make sure that the SSI application is still processing because it's been about 18 months since applying. I'm not sure. The phone interview person applied for both programs now. My son is 20, so applying as an adult. Okay, couple of things. So on the Social Security website, you have a login where you applied. You can log in and see if the SSI application is still pending. Another thing that you guys can do, I'm going to put this number in the chat box. This is for Texas, I should preface. This is the phone number for Disability Determination Services in Austin. And it's also known as DDS, so Disability Determination Services in Austin. Basically, you can call them, provide your child's Social Security number, find out where the application is it waiting to be assigned, has it been assigned to a caseworker, do they not have it at all? If you call that number and they don't have the application at all, that basically means that the Social Security office, the local office, never sent it in and nothing is happening. DDS is where the applications, once completed from the local office, goes, and that's where they're going to request the medical records. They're going to do the determination, and they're going to make a decision and send it back to the local office. The local office will contact you when they have a decision and will ask you to come in. They're going to ask you for the bank account. That's when you bring the rent agreement. That's basically how that works. So as I said, decisions are taking up to a year, sometimes longer. After the local office has finalized that application, it goes to DDS, and this is basically how they're going to process that application. DDS answers the phone in Austin. All states have a disability determination service office, and they're usually in the state capital, but not always. So you're going to want to check your local state for your disability determination office. So what if you have a presumptive condition that there's a compassionate allowance for? So that's a mouthful. And so what I'm saying is presumptive condition that there is a compassionate allowance for. So basically there is over 200 conditions that there is a compassionate allowance for, and basically what the compassionate allowance is that they will fast track the application, that it is presumed that the person is disabled, and they will fast track the application. And it used to be, if they were fast tracking the application, that application might be, handled in 3 months or less. Even the fast tracked applications are taking a little bit longer, but if there is a likelihood that the case would be approved, they can make that presumptive decision. So hold on one second. I want to just make sure that we've got a couple of the questions. So the phone number for DDS, 1-800-252-7009. One person says, this is a good question. I adopted a family member with an intellectual disability. Can I apply for SSI, SSDI? Adoption is considered, so they could be considered under a parent's record if a parent is already getting Social Security or SSDI. If the child is over age 18, sure, you can apply for SSI. It depends on the unique situation. There are a lot of grandparents or siblings that may have guardianship of their family member. Guardianship in itself does not allow an individual with a disability to be covered under that grandparent or sibling's record. There would have to be an adoption in place for that. If a child has such severe disabilities that he or she cannot work or manage money, should this parent still open an account if in the child's name to have bank statements show for their child? It's not necessary, because there would be a representative payee for that individual. So if we have an individual that has an intellectual disability, they definitely can't handle money or things like that. A parent can be appointed as the representative payee for said individual. And once that appointment is in place, then you can open up a representative payee account. One thing that I want to mention is that when we were talking about the $2,000 limit, and we can't have more than $2,000 in our child's name outside of a ABLE account or a special needs trust. If you have a child who has a bank account and they have more than $2,000 in their name, there are legitimate ways to rectify that situation, and there are not correct ways to rectify that. So the wrong way is to close the account and move the money to your account. That's just wrong. You can't do it, and there's a look back, and it'll come back and bite you. But the right way is you can spend the money down for the benefit of said child, and show receipts for that. You can move the excess money over the $2,000 into an ABLE account. An ABLE account can have $19,000 a year. You can also open a first party special needs trust and move excess money above and beyond that $19,000 to a first party special needs trust. Okay, so those are the right way to do it. The wrong way to do it is to close the account and move the money to your name. Okay. Examples of presumptive disabilities. The one that sticks out that's clear is Down syndrome, cerebral palsy, muscular dystrophy. An intellectual disability is not a presumptive condition unless the intellectual disability comes along with the inability to perform activities of daily living, self-care, toileting, transferring, bathing, those types of things. Amputation of a leg at the hip, total deafness, no sound perception in the ear, total blindness, no light perception, bed confinement, stroke more than 3 months in the past. This is just a few. You can go and type in presumptive condition, compassionate allowance, and they will have a link where you can type in your child or your loved one's diagnosis and see if they qualify for a presumptive condition. Okay. So one of the things I also want to mention is guardianship and the Social Security Administration. The Social Security Administration recognizes guardianship. They do not recognize supported decision-making agreements or power of attorney, healthcare power of attorney. So having just a power of attorney and healthcare power of attorney doesn't mean that they're going to talk to you. You will need a special form. I'm not saying, well, if you're going to file for SSI, you got to have guardianship. I'm not saying that at all. There is a special form. If somebody wants to put this in the chat box for me, the special form name is SSA 1696, SSA 1696. That is a form that your child that is not under guardianship, your adult child that is not under guardianship, can sign, and it can allow you to call on their behalf. So that is a legit way to do that. If you don't have the SSA 1696 on file, they may give you a hard time talking to you, even though your child may not understand to correspond with them. So you're going to want to get that SSA 1696. If your child or loved one is under guardianship, you're going to want to provide that guardianship to the Social Security Administration. Furthermore, if your child is not under guardianship and you've got the 1696 on file, they're not going to automatically appoint you the representative payee for their benefits. You may need a special letter from the doctor indicating that the individual cannot handle money and that they need a representative payee for their benefits. and then they will appoint you for as a representative payee. So there's no sense in arguing with them about your legal documents being legitimate. It just doesn't matter. They don't take power of attorney and healthcare power of attorney. So I just want everybody to be clear on that. Okay, so let me see. We've talked a little bit about the childhood disability benefits. One person said this is an example of a person who already had a person pass away. My 18-year-old disabled daughter receives survivor benefits from her father. Will these convert to her benefits once she is approved? So she will continue to get survivor benefits, but once she turns 18, you need to apply. You probably need to submit the SSA 1372 BK if your child is still a student in high school. So her survivor benefits will continue to age 19, and you need to apply for benefits. Now, once she's 18, you're applying to keep the survivor benefits because she has a disability that started prior to age 22. And it is not always clear that you need to do this, but you definitely do. So don't find out at 18 or 19 that benefits stopped completely and that you needed to reapply, or advise them that she is disabled and her father died. So this was an example that if the father died prior to the child turning 18, the child was likely not getting SSI and Medicaid. So when the father died, that the clock starts ticking for 24 months for Medicare once the child turns 18. So this child will be eligible for Medicare, automatically enrolled in Medicare 24 months after the 18th birthday, so long as the survivor benefits are approved to be continued. One person says, my adult son is receiving emails finally, but they are not giving him the max amount. I'm not sure what to do next. The other reason why a person might not be getting the max amount is if they're working, and I'm going to talk about that in just a second. But again, the reason they may not be getting the max amount, if they're getting $644 a month, it's being reduced by 1/3 because there's not a rent agreement on file, and that is how that goes. One person says the SSI denied benefits for my daughter. This is not uncommon. Very commonly, we see people that are denied the first go round. I would say that it is not uncommon to see a person that has ADHD or maybe level 1 autism be denied the first go round, but you appeal. You always want to follow the letters to a T. If they say you have 60 days to appeal, they mean it. So make sure you file your appeal. You can reach out to us. We have suggestions on that. We have referrals on that as well. So if you don't want to handle an appeal yourself. I have multiple kids with disabilities. My youngest, we applied whenever she turned 18. She was denied 3 times, multiple appeals, and finally approved at the federal level. It took 3.5 years. So it's a little ridiculous, but don't give up and don't throw in the towel. Because sometimes they could have been denied, and that's where that DDS phone number comes in. They could have been denied because the doctor didn't send the medical records in, so they didn't have enough evidence for disability. They could have been denied for other reasons. What other options are available besides utilizing a fair share when there is no mortgage? Again, just have a rent agreement saying that the person is paying rent. So to this person's point, there is a such thing as a fair share where they take the utilities and they take the rent and they divide it by the number of people in the household, and that's the person's fair share. You can do the fair share, but I feel like the rent agreement is easier. Just saying that they're charging a flat amount for room and board, and it includes everything. Because somebody said, should I use electric bills or utilities, and that you can or you can't. I just lump it all together and charge one amount. When filling out the application, it asks something along the lines as to needing me to explain why my child would qualify, and then it cut off. So I guess that meant for benefits. But this is where you're going to explain what the child's disabilities are, how it affects their activities of daily living, what they can and cannot do, if they cannot be left alone, if they cannot work, if they have physical limitations, if they are confined to a wheelchair, if they're deaf, they're blind. all of those things. If they have an intellectual disability, an intellectual disability is considered an IQ of 70 or below, or 75 and below, with multiple disabilities. So child support, I'm going to spend only a second on this, but if you're taking notes and you're in a divorce situation, some states, Texas is one of them, continue child support post age 18. If you're that person, if you're getting child support and child support will continue post age 18, that child support needs to be redirected to a first party special needs trust. You'll need two attorneys, one to set up the first party special needs trust and a family law attorney to get the court order to move the child support to the first party special needs trust. If you don't do this, the child support will be counted against the individual for income purposes. Even though that money comes to you or the parent, it will be counted against them. So it does make sense for, even though in divorce situations, maybe not everybody agrees, but I think it would be good if everybody could agree that the child support needs to go to a first party special needs trust. We have entire webinars on special needs and divorce, and some caveats that you should pay attention to. So check that out on our YouTube channel if that's you. If you're in the middle of a divorce process, getting these things right on the front end will save you money on the back end. So I always think that, if you can get it straight on the front end, that would definitely be better. One person says, if an adult child receives childhood disability benefits, should they still submit a rental agreement? They don't have to. That is more for SSI, not Title II benefits. So that is a great thought. Now, you could go ahead and still submit a rental agreement. So that way each month when the money comes in, you move the money for the rent from the account where the or childhood disability benefits goes to your account. Now you could turn right around and put that money in their ABLE account. But if you're running into an issue where they're having higher amounts of money deposited and you're getting closer to that $2,000 maximum, then you may want to still have the rent agreement in place, but you don't have to. So one person asked a great question here too. Can child support go into an ABLE account? That is a great question, and the answer is no. And the tricky thing about the ABLE account is no, child support can't go to an ABLE account. If it could go to you and then go to the ABLE account, but it's still going to be counted against them for SSI income purposes. Whereas if it goes to a first party special needs trust, it is not going to be counted against them. So that is an important topic. So now I want to talk about how working affects SSI, Title 16 benefits. Basically, for every $2 a person earns when they're getting SSI, supplemental security income, they're going to count $1 against them. There's a $20 general exclusion. They also don't count the first $65 of earned income. So in the example that a person is earning $1,200 a month, gross earnings, they would subtract $85. It would come to $1,115. They would divide that amount by 2. There would be $557.50 of countable income. They would subtract that from the $967 a month or whatever benefit amount the person is getting. And then payable, it runs a month behind. So it's like not the next month, but the following month would be payable $409.50 payable in SSI benefits. If your child goes to work, it is important to notify the Social Security Administration. It is your responsibility to report their earnings monthly. They're due on the 1st, they're late on the 5th. I suggest, having a reminder to submit their pay stubs. Once you've advised who their employer is, they will eventually update that in your online SSA login, and you can upload pay stubs through the login. Until they've updated that in your login, you'll need to fax in the pay stubs. Again, I suggest fax. You could walk them in. I don't suggest mailing them, but you could. Okay. FedEx and UPS doesn't expedite it any faster. It just costs you more money to send it in. So when we talk about income in earnings does not necessarily affect SSDI or childhood disability benefits. While it does reduce SSI, earnings does not reduce SSDI or childhood disability benefits unless as long as their earnings are less than that SGA, that 1,620 gross earnings per month. So it's two different programs, and this is where I was saying at the beginning, understanding the differences of those programs. One thing for a person that is getting SSI and is working, if they're a full-time student under age 22, between the ages of 18 and 22, there is a student earned income exclusion that you can have signed off on by the school, again, approving that they are a student, and they will not reduce their SSI for their earnings. A full-time student means college or university, 8 hours a week, or in grades 7 through 12 for 12 hours a week, or in a training course to prepare for employment at least 12 hours a week, or 15 hours a week if it involves shop practice, or homeschooling in grades 7 to 12 at least 12 hours a week. You have to ask for this. It is not automatic, and it's only between the ages of 18 and 22 for SSI. So we already covered this disabled adult child under a parent's record, so I'm going to keep moving. For SSDI to be entitled to RSDI, SSDI, Retirement Survivor Disability Insurance, is 18 years or older. Now for survivor benefits, certainly people under age 18 qualify for survivor benefits. Disability began prior to age 22 is a dependent of the insured worker. Remember, this is Title II. We have a kid that never worked or never will. If their disability started prior to age 22, they can be covered under a parent's record. Now, one thing I want to mention to you, if you're on here and your child is over age 22 and you've never applied before, and you're worried that you missed the boat, you did not miss the boat. You just need to have proof that the child's disability started prior to age 22. One person says, does adult transition service through the school district count as being a student under age 22? It sure does. That's a great question. So furthermore, they've not previously performed substantial gainful activity. And again, that amount was 1620 gross per month. So we talked about the Blue Book, and that was the medical impairment guide. The Social Security Red Book, it's a general reference source about employment related provisions under the Social Security Disability Insurance and Supplemental Security Income SSI programs. It's for educators, advocates, rehab professionals, counselors, and yourself in general, of how work affects the two different types or multiple different types of benefits. So you're going to want to check this out. A lot of our family members may be in VR, vocational rehab. They may be in programs to help them get to work. So there are resources out there to learn more about this. VR has subject matter experts for benefit specialists, so you can have counseling through that. There is also free benefit counseling through the Social Security Administration. You can type that in the search box when you are on the Social Security website. But free benefit counseling, the housing assistance, SNAP, healthcare benefits, they've got it all. And again, I said there's free benefit counseling through vocational rehab. Now, we have Texas Workforce Commission vocational rehab. All states have vocational rehab. It is designed to close the gap on impediments to employment for people with disabilities, okay? So just know, if you've got questions about that, or you've got stump the chump questions about that, there is free help out there for you. So I'm not going to go in great detail today into the Title II stages of return to work, because a lot of times people are afraid that if our kid goes to work that we're immediately going to lose benefits. That's not true. In the Social Security Red Book, they're going to talk about the 5 stages of work, and so you can see those there. But the 5 stages are the trial work period, the extended period of eligibility, the cessation and grace period, expedited reinstatement, and the initial reinstatement period. So you're going to want to check those out. If your loved one is working or they plan to work, just look at that. And the key magic thought is, if they're working, it's okay. But in order for them to be able to continue to be covered or be covered in the future under a parent's record, they have to earn less than 1620 gross per month, and that amount will go up next year. It goes up every year. So they have to earn less than that substantial gainful amount, or they will lose the right to be covered under CDB. Another way that people lose the right to be covered under CDB is that they get married, okay? So just know that if they get married, it can mess everything up. There is a such thing as impairment related work expenses. It could be travel expenses or special aids or things that happen that the person must have to be able to work, and they will reduce that from their earnings. Another thing is there is something called a subsidy or a special consideration. This form, somebody put this in the chat box for me, is the SSA 3033 form. SSA 3033. This is a subsidy or special condition. If you have a loved one, maybe they're working for a family business or a family friend, maybe they're working for a company that supports people with disabilities. Your loved one really can't do all of the job that a neurotypical person would be able to do, but they support people with disabilities. Maybe your loved one can only do 25% of the job. And if an employer signs off on that, they will not count 75% of their income against them. So just know that there is a work subsidy form. It would have to be signed off by the employer, and then they wouldn't count that income against them. Okay, so somebody said, let's see here. I just want to check my chat box here. Definition of a dependent. Parents are divorced. Parent with activated record is a disabled veteran. Physical custody is with the other parent. Are they considered disabled parents dependent? Yeah, I mean, it has to do with who provides, and it could even be a step parent in that example if the step parent is providing more than 50% of the support for said individual. One of the things I want to mention from the VA or military pensions, there is something called a helpless child through the military. There is a way in 2015, the law changed to where you could name a first party special needs trust as a beneficiary for a military pension. And a lot of people don't know that that law changed. That's important to know, because if you're planning on leaving a military pension to a special needs child, you've got to leave it to a first party special needs trust and not to them directly, or they will lose their benefits. Same thing with VA benefits. You're going to want to check on that as well. But some of the benefits from the helpless child from the military, they may get TRICARE for life, or health benefits through the military for life. So those are all things that you may want to check on, and we can one off on that. So I'm going to skip over, so because we are running out of time for today. We've had a lot of great questions. ABLE accounts, I'm just going to hit on this briefly. We do entire presentations on ABLE accounts. ABLE accounts are set up under the 529A tax code. It does not jeopardize SSI or Medicaid or other public benefits. The beneficiary is the owner. Income earned in the account is not taxable, and distributions are not taxable as long as it can be construed as achieving a better life for an individual with a disability. The disability in this example had to start prior to age 26, and in 2026 that age is going up to 46. The amount changes each year that you can put into an ABLE account. The amount for 2025 is $19,000 a year. It's subject to the gift tax exclusion. Whatever the gift tax exclusion is how much you can put into an ABLE account. You can put an additional $15,560 if the individual is working up to their earnings amount. So if the individual with a disability is working and they only earned $5,000, you can put an additional $5,000 above that $19,000 in. So states may be able to claim reimbursement paid by Medicaid. There is a Medicaid payback on ABLE accounts for Texans. Some states don't have a Medicaid payback, but if you're a Texas resident, it doesn't matter what state you have your ABLE account in, there is a Medicaid payback on the ABLE accounts. And there is a calculation on the Social Security website that explains how Medicaid paybacks work. And in my experience, I would say that the calculation is a little bit clear as mud. One thing to know is that you never want an ABLE account to be over $100,000. If it goes over $100,000, you're going to lose SSI. So you want to spend it down prior to it having more than $100,000 in it. So that is a big thing. And another thing that people ask me all the time is, why should I have a special needs trust and an ABLE account? And an ABLE account can have a limited amount of money in it, before disqualifying. A special needs trust can have an unlimited amount of money. And like one person found out, we cannot put child support to an ABLE account. Okay, it can't go directly to an ABLE account. We also can't make a beneficiary an ABLE account. So if I had life insurance and I wanted to make the beneficiary the ABLE account, you can't do that. However, you can make a special needs trust a beneficiary, which is how you should do it. Okay, so ABLE accounts can pay for shelter and monthly debt services without a 1/3 reduction to SSI. If you pay for shelter and monthly debt service for shelter and utilities and things like that, there would be a 1/3 reduction to SSI by paying for that out of a special needs trust. And some people don't care about that at all, and that's okay. So, and some people say, well, I heard you can't pay for housing out of a special needs trust. That is not true. You absolutely can pay for housing out of a special needs trust, but if the person is under Title 16 and they're getting SSI, there would be a reduction to the SSI for that. Okay, so we've come to the end for today. These are some of the things that keep on your special needs planning radar. How to develop a comprehensive special care plan. We can help with that. Future care cost estimates. How much money do we need to fund a special needs trust? Medicaid waivers. How to get on the list. How to come up on the list. What is the waiting list? Understanding waivers. They're designed to waive off some of the cost of care for caring for an individual with a disability to keep them in home and community-based services. Beneficiary designations. If you're taking notes today, write this down. You should not name your disabled loved one as a beneficiary on anything you have. The right way to go about doing that is to name their special needs trust for the benefit of said child, and that will preserve their eligibility for these programs that we've been talking about. We do suggest touring residential living communities. I think on the 24th of this month, we have a residential living panel where we have a lot of residential living places that are going to come on and tell us who they are, where they're located, who they serve, whether or not they take waivers, and what their costs are. So thinking about guardianship, alternatives to guardianship, such as supported decision-making agreement, power of attorney, healthcare power of attorney, these are all important considerations. Post-high school education options. Are they going to go to a transition program that's through the state, through the school? Are they going to go to an outside transition program? Are they going to go to higher education? When you guys get your slides today, there's going to be a link in here for our upcoming webinars. You can subscribe to any of those upcoming webinars that make sense to you. We work on a collaborative team here at CPG, and we stand ready to help you in your planning process, whether you have done a lot of planning and you need a second opinion or a look under the hood. Maybe your advisor doesn't have any background in special needs, or maybe you've not done any planning, or maybe you just need to pick up where you left off. We are your team, and we stand ready to help you wherever you are in your journey. We always offer free personalized consultations here. This QR code will take you to our calendar where you can schedule your free personalized 45-minute consultation. So if you had questions today, we weren't able to go as deep and wide as you had hoped, we can definitely help you with that. We work on the collaborative team here at CPG, so whether you get me or other members of the team, we all work together. So if we choose to work together, you're going to get all of us, not just me. So it's certainly been my pleasure being here with everyone today. We had a lot of write-in questions and a lot of questions into the chat box, and I always love the questions because usually your question is not only helping you, but it's helping somebody else as well. So it has certainly been my pleasure being here today. Thank you to North End ISD, and we look forward to partnering with you again soon. And thanks for attending, guys. Have a great day.
Thank you,